Hey, good evening, everybody, and nice to see you. Thank you for joining us. My name is Dr. Moshe Dekel. This is the first of many to come of Facebook Live. And the reason why we're here today is really to uh, facilitate and to give information to people who are interested in to actually address their issues, your medical issues, in a holistic fashion. So today we're coming from my home in Hilton Head on the North Shore of the island in South Carolina. And a little bit about myself so you know who we're talking about. I've been in medicine for 42 years in clinical medicine. I've held different positions during my career, including assistant clinical professor of OBGYN at Stony Brook University in New York. I used to be the medical director of a birthing center, Long Island, New York. But throughout my career, I always had and continue to have a private practice. So I used to be an OBGYN, board certified for 20 some years, delivered a lot of babies. And then I changed back in 2000, so about 22 years ago. One of the questions that I get most is, what made you change? And I tell my audience, I said, listen, I've never seen any doctor that woke up one morning and decided, okay, today I'm going to be holistic. Everybody has a story. My story was very simple. I was solo practitioners working many, many hours, a lot of them during the night, delivering babies and doing operations, and my neck and back doing this all these hours kind of told me, hey, after 20 some years, 25 years of doing it, you're out. You cannot do this anymore. And obviously, it was not a good day for me. But I was kind of, I think it's by design, actually. I'm the type of person that when the door closes, I don't ponder too much about it. I say, okay, what other doors are open? And I opened the door, what I like to call the real medicine. And I was astonished to see how much I was not taught. And it took me a while to grasp why I didn't have any teaching whatsoever about nutrition in medical school, not even 1 hour. And I realized that conventional Western medicine is not about curing, it's not about prevention, it's about how fast can we make a diagnosis and are we going to prescribe, what we're going to prescribe, are we going to do any tests, what the tests are going to be, and also what kind of procedures we're going to do. So by teaching doctors that they actually prevent goes contrary to the philosophy of Western medicine. So about 22 years ago, I joined what I would like to call my second medical school, which I still am in because every day I'm learning something new. And a lot of it is actually my patients and actually the way they respond to the therapies that I give them. So, this, needless to say, opened my eyes to the real possibilities of natural medicine, holistic medicine, integrative medicine, whatever you want to call it. So, our mission is kind of very simple. Uh, we are in the information business, okay? Put it very crudely, obviously. We want to give information to all of you to actually be in a position to decide what direction you want to take in order to take care of your health. Number one, preserve it. Number two, slow down your aging process. And number three is if you do have any problem, and most patients do, how do you want to take care of it? Do you want to take medication for the rest of your life? Do you want to take medication that comes in with tremendous side effects? Uh, According to recent studies, actually not so recent, it's been a while, uh, if you research iatrogenic deaths, which means iatrogenic means due to medicine, it's number three leading cause of death in the United States. So we're very good at emergencies, okay? Heart attacks, strokes, accidents, injuries. But unfortunately, I have to admit or state that we're not good in taking care of people long term. Okay, we're not teaching people, for instance, with diabetes, especially type 2, what they need to do in order to get rid of their diabetes. But we're very great in doing what? Giving medications that really don't help. Okay, it just delays the inevitable. So this is our goal. Our goal is to give information. We also are interested in your participation. You can give any comments at this point or any questions that you may have, because really we don't have an agenda. We would like to address the items and the questions that are important to you. So the more you participate and ask questions, the more interesting it's going to be, because this is not going to be contrived. It's not going to be, listen, I know what the issues are, and I can talk about them for a long time. But I don't know if the issue I'm going to talk about is going to be specifically related to your issue. So anybody who participates in this conversation, so to speak, will be able to get an answer directly from somebody who's been dealing with this for a long time and very successful in it. Because why? I see the results. I see the results that I get from my patients. And that's what keeps me going, because I really don't have to work anymore. But I don't need to, I don't plan to retire, because to me, it's not even a job. To me, it's really a work of love in a way that very fulfilling to me. And it's not even close to the amount of energy that I used to spend as an OBGYN. So to me, it's a no-brainer. And I'm here to stay to help as many people as I can. So this is really the background. Uh, we're going to be on air every 2 weeks on a Sunday at 6 o'clock. We really invite participations and sharing, because we feel that the most problematic issue today is really lack of information. Censoring, I don't want to get political here, but you know what I'm talking about. So the more you interact with us, the more you share, et cetera, you're actually increasing our visibility to the rest of the people who might have an interest in exploring this way of taking care of themselves and their families. So this is really the short and the long of it. Uh, would like to get now to a few questions that were asked in advance. And I have my sidekick here. Here he is.
Hey, everybody. I'm Brandon Roberts. I'm the Director of Marketing for our clinic here in Bluffton, South Carolina. It's a pleasure to meet everybody. Welcome to the Dr. Dekel's every other Sunday live stream at 6 p.m. We're very, very proud and very happy to have everybody here tonight. Let's get to some questions.
And again, he's the brain behind this, because he's setting up this whole contraption, et cetera. So he and Kelly, his wife, are very instrumental in carrying the message to our patients. So you want to give me the first question, sir?
Yeah.
All right.
All right. So this is from El Santoro. It says, "Hi, Dr. Dekel. I'm postmenopausal. I exercise and I eat well. I take supplements to reduce hot flashes. However, I find that my energy is low and I do suffer from hot flashes from time to time. Do you have any suggestions on how I can increase my energy and manage the hot flashes?"
Okay. Well, this is a very good question. Thank you for that, because I see it on a daily basis. Okay, so we're dealing with a couple of things here. We deal, of course, with postmenopausal, which is hormonal, hot flashes, which are related to that, and we deal, of course, with lack of energy. Okay, and regardless, men or women, they both complain of not enough energy. All right, so let's take one issue at a time. Let's take the postmenopausal. Okay, so usually menopause starts in the United States around the age of 51. However, we have women who go into menopause at 46, and we have women who go into menopause at 56. Okay, uh, and it's kind of interesting, because not every woman has hot flashes, but quite a bit are. And hot flashes are really there because the thermostat of the brain, the the center that actually dictates the temperature control is being influenced by the change in hormone balance between estrogen and progesterone. So what happens is when we get to a certain age, when the ovaries are actually reach their useful life, so to speak, in other words, functionality wise, okay, what happens is that they stop ovulating, okay? Now, because of ovulation doesn't occur, there's not enough production of estrogen, all right, and also of progesterone. But the interesting part is that progesterone falls down first, okay? And we're talking like perimenopausal, before we kind of menopausal, which is really by definition where we haven't had period for at least 1 year, so we consider menopausal. But changes happen before that. And a lot of women will probably say, yeah, yeah, that's me. Okay, what happens is we start missing periods, okay, uh, gaining weight, depression, anxiety, being being labile as far as moods are concerned. Okay, and that's because progesterone starts to go first. So what happens is the balance between estrogen and progesterone starts to favor estrogen, and that starts to click the hot flashes uh, that are very disturbing. And again, I have women that have it every hour on the hour, and obviously can't sleep like that. And by the way, in holistic medicine, sleep is more important than food. Because why? When we sleep, we repair. If we don't sleep, we don't repair. We don't repair, of course, we break. So it's paramount importance for women to understand that they don't have to suffer. Okay, so you say, well, what do you do? Well, in the beginning stage, what I would do is I would actually of course, do some blood testing to verify where we are. Also do kinesiology testing, which is actually an energetic testing. Okay, it's been around for a long time, and anybody that is interested to see what kind of modality I use, it's actually called quantum reflex analysis, QRA, actually put together by Dr. Bob Marshall. And that allows me to find out, okay, what's going on? Okay, do you need progesterone? Most likely in the beginning you are. So that's what I do. I give you bioidentical progesterone in the amounts that you need. And guess what? The hot flashes go away. And then you can sleep. And by the way, progesterone is excellent in sleep induction. Okay, so we take it at night. Okay, and you say, well, how do you take it? Well, you can take progesterone a couple of ways. You can take it as a cream, or you can take it as a pill by mouth. And you say, well, which one is better? Well, it all depends. If uh, sleep is an issue, I like to give it by mouth because it looks like it's helping sleep better than a cream. But the cream is much more convenient, etc. So really, it doesn't make any difference. When we give you the right amount of progesterone, all of a sudden you can sleep. Not only that, but what I do recommend highly is using melatonin in a spray form,
It's amazing.
because when you put melatonin under the tongue before you go to sleep, the absorption gets into the bloodstream very fast and acts very fast. So it's easy to do and it's effective. And if you wake up in the middle of the night, guess what? Take another dose, and before you know it, it's morning. Okay. Melatonin will work with about 80% of patients, and 20% that don't help. It doesn't help. I would recommend a CBD formulation, and between both formulation, you will have the right results. So that's the hot flashes part. Now, as I said, progesterone comes down first, but then as we get into complete menopause, estrogen production also goes down. Okay, so if you read about estrogen, progesterone in the holistic literature, you will see that, and that's very important because a lot of women are concerned because there's information out there that taking estrogen, progesterone actually increases the risk of breast cancer and uterine cancer. And that may be true with conventional pharmaceutical medications. okay? However, it's totally untrue if we're taking bioidentical, natural hormone replacement therapy. And there are a ton of studies that show it, that women who take bioidentical hormone replacement correctly, okay, will have less cancer than women who take nothing. So I encourage everybody to actually confirm my uh, assertions. And and if you can't find, sorry, if you cannot find the literature on that, just send, shoot us an email, and we'll send you the citations on this, so you can read for yourself. Thank you, my dear.
That's service.
Yeah. So again, I always encourage my patients to listen. You're responsible for your decisions on which direction to go. And I say, always find out. Don't take any doctor's word as granted, including myself. Confirm it. As Reagan said, trust but verify. Okay, so once you verify, once you understand enough about what's happening in your system, then you can actually make a decision from knowledge and not from fear. One of my problems with conventional medicine, it's a big problem, is that their main method is what? Fear. If you don't do this, this and this will happen. If you don't do that, that and that will happen. Well, verify. And if you have a question, and if you cannot make a decision, that means you don't have enough information. So what's the remedy? Continue to ask until you get the right information for you. And what else? You feel within yourself that this is the right way for you to go. So, and again, as far as estrogen is concerned, usually I give it in the form of a cream. Okay. There are a couple of different ways to do it, different estrogens. And again, the formulation will depend on what your specific needs are. Okay, because not everybody needs obviously the same concentration, the same combination. So we find out what really works for you, and that's what we do. Okay. Talking about hormones, also, some women have low testosterone. Okay, testosterone is also very important for muscle, for bone, for prevention of osteoporosis, for libido. Okay, so again, we do blood testing usually, but you can do other testing. We verify it, and if you didn't need testosterone, I'll give it testosterone. Okay, you say, wait a minute, I thought testosterone is men's hormone. It only depends on what quantity we're talking about. Okay, men need about 100 times more than women. Okay, and one of the things that we were asking, well, will I grow a beard? No, I said, no, you'll not grow a beard. Okay, the amount of testosterone we're given is really just to maintain what your body actually needs to maintain. Another hormone that actually also important I want to mention is DHEA. DHEA is a hormone that comes from the adrenal glands. The adrenals are small little glands about this big. Okay, it's on the top of the kidneys, so we have two of them. These glands are responsible for stress response. Okay, and one of the hormones they are making is called DHEA. And DHEA is also important for women's libido, okay, because some of the DHEA in women will convert to testosterone. Okay, so now let's go to the other part of the question. It was energy. So everything in life is energy. Okay, so the question is, how do we get energy? Well, obviously, it's what we eat, okay, how we digest, how we assimilate, okay, how we burn, very important. We'll talk about this in a second. How we eliminate, detoxify, okay. So obviously, diet is a major topic, and we're not going to go into this at this point unless somebody has a question about diet, and absolutely we're going to address it. But assuming we have the right diet, and I usually recommend a light keto or like keto, and I don't get it diet, I call it lifestyle, which means what? Much less carbs and more fats, okay? And digestion is a major part of energy, which means, number one, digestion starts at the mouth. So we need to eat slowly. Most American will admit right away to eat quickly, That's not a good idea. So slow down. All right. Then most of us need what? Hydrochloric acid, digestive enzymes, and ox bile to help us with digestion. And on top of that, we need what? Probiotics. Okay. So once we have gut health, now we digest. Now we have to absorb it, and now we have to burn it. So the burning is being signaled by what? Thyroid and adrenal. Okay. The thyroid hormone, okay, we have two major ones, T3 and T4. You probably heard about that. Actually tells every cell in the body how much energy to make. Think about that. Okay. And the underactive thyroid in this country is an epidemic. I have to repeat it. It's an epidemic. So if your energy is down, please don't attribute it to getting older. Okay. We really have to check what's happening with the adrenal and the thyroid. And you say, what about the adrenal? The adrenal works together with the thyroid, okay, with first certain hormones, etc. So when we support the thyroid, we need absolutely to support the adrenal. All right. So I have patients that we have this conversation and they say, well, here's my recent lab that I had with another doctor. And he tells me that my thyroid is absolutely fine. So who's right? Well, I check it, and obviously, yes, it's within the normal range. And that is the problem that I have with conventional medicine. They take a look at the labs and they don't listen to you. Meaning what? All the parameters of low thyroid and adrenal are being said by you when I interview you. No energy, hair loss, brain fog, dry skin. I'm getting signals here. Okay. Dry skin, constipation, okay. For a young woman, infertility, and on and on and on. Losing the outer third of your brows, okay. And yet your blood tests are fine, okay. So how do you reconcile that? Well, over the last 22 years, women who came to me with these kind of complaints and perfect blood tests, once I support the thyroid and adrenal, guess what? They have a life. So, how long is it going to take me to believe that effects on the grounds actually matter more than just the blood test? So you say, well, how does it work? Why doesn't my blood test show that I have a problem? Well, the issue is really complicated, but I'll try to make it very simple. Hormones talk to receptors. Receptors are listening stations we have on every cell of the body. Okay. If those receptors or listening station are polluted with chemicals or any other toxicity that accumulates over the years, even if we have the right amount of hormones in the blood, guess what? The transmission is not going to go through. And when that happens, yes, you have normal blood levels of the hormones, but you don't behave like that. Okay. Otherwise, you won't come to see me because you have no energy. And the proof is in the pudding. When I give you the support that you need, and now you have energy, and now you have a life. Now there's really no discussion about how come my blood's this and my reality is that. Okay, so you really need to listen. Every doctor needs to listen to patients. And yes, the blood tests are important. I'm not trying to poo-poo it or minimize it, but it has to be put in context. Okay, in my opinion, it's not good medicine to look at blood tests and say they're fine, and you're complaining that all of the above that we just spoke about, including depression, by the way, is there, okay? And as a conventional medicine, I will say, okay, everything is good. Let me give you something for depression, because now I have a prescription for you. In my opinion, it's the wrong way to go. And guess what? A lot of my patients come to me, have seen multiple doctors, and they're still not happy because why? They don't have the energy they want, and they have marginal life at best. So this is really not difficult. I see it on a daily basis, uh, and patients get better once we address it correctly. Was there any other part of the question that I missed?
No, you actually nailed all of it.
We had a
And
shout
then
out
some.
though.
Yeah, we actually have a Angela. She was you were actually her OB for all three of her children in Long Island back in 1996.
No kidding.
And
Okay.
she says you remain still to this day the best doctor she's ever had, hands down.
Well, thank you so much. I'm blushing.
Yeah, she definitely has a lot of love for you. So
Thank you. Thank you.
we have our next question. If
Yes.
you'd like to go, let's go over to our question stack we have here. This is from just no name on. Oh, this is Mimi. So Mimi says, I have severe knee pain, osteoarthritis, a torn meniscus, and barely any cartilage left. Is there anything that I can do or take to help or / cure other than cortisone shots or a knee replacement? Thank you in advance.
Thank you for that question, because I see a lot of patients like you. The first simple answer is no. Don't take any cortisone shots. Cortisone really decreases inflammation, and therefore it's like, okay, I have a relief. Thank you very much, doctor. You're genius. The problem is 3-4 months later, you're back in the same state. So is the meniscus, is it a meniscus tear, or there's a mention of trauma at all?
No, it just says
No trauma.
severe knee pain, osteoarthritis.
Okay,
torn
okay.
meniscus.
So osteoarthritis is really a chronic condition which is due to inflammation. Inflammation starts in the gut. Okay, so we have to do a few things. Number one, we need to get your diet under control, which is really the keto. And my suggestion is just research keto recipes. Okay, keto recipes are very simple and very delicious because they are a protein, a vegetable, fat on top of it, good fat, avocado, nuts and seeds, coconut oil, olive oil, grass-fed butter, etc., grass-fed beef, etc., and a salad. Okay, so what we need to do is avoid carbs. Definitely avoid sugar, which is very inflammatory. Okay, so get any sugar, take out of your diet completely. I would do stevia, I would do monk fruit, and as far as the carbs, really cut them down. Okay, and then what we need to do is assess what kind of digestion you have. And the majority of us, as I just said before, we need digestive enzymes, we need probiotics, and we also need to address what we call the leaky gut syndrome. Leaky gut syndrome, all of us have it to one degree or another, and it really, in simple English, it's the permeability of the gut has increased, okay? Just to illustrate, if this is a cell in the gut and this is a cell in the gut, this is a healthy gut, okay? Nothing's supposed to go in between the cells. This is a leaky gut, okay? So we have programs that actually can help close the leaky gut, but it also starts with the lifestyle, which is light keto. Why do I call it light? Because if you look at keto diet, or keto lifestyle, it's very hard to do because the original keto is 75% fat, which is not easy to do, and I don't recommend it. But on the other hand, cut down the carbs as much as you can and still have a lot of fun eating. So that's important. So that will take care of stopping the osteoarthritis from progression, because once we have that inflammation, after years and years of inflammation, it starts attacking whatever it feels like. In your case, it went to the joints, and now we have osteoarthritis. And in fact, at least one knee to point at. Somebody may recommend knee replacement, which I highly recommend not to do. Okay. So what we do, we have 3 choices to address this issue. Number one, we can do an ozone injection. Okay, it's called Prolozone, and you can research that. And again, if you have any questions, just email us, and we will do what? We'll just give you the information on it. Just send you information so you can research that. The second possibility is called PRP, platelets-rich plasma, which is actually taking blood from your own vein, okay, spinning it down, taking the portion that has the platelets, okay, we activate them, okay, and we inject them into the joint that we're talking about. It has growth factors that actually help regenerate the knee. Ultimately, the most sophisticated, more advanced, and best results we can do is actually with stem cells. But here's a caveat: we can't even at this point we cannot even call it stem cells because of the FDA. Okay, so we don't call it stem cell; we call it allograft. It's derived from usually a baby that was delivered via cesarean section, the cord and placenta being donated by the couple to the lab, and the lab actually extract the essence of it, and then we are injecting into the knee, and we have incredible results with it. Actually, with prolozone, okay, we need few injection depending on how you progress. Usually PRP is less, and usually with allograft. Usually one injection is good for a couple of years, and especially if we take care of what? Of the chronic inflammation. And chronic inflammation is really the hallmark of any and all chronic diseases, including cancer. So it's really a little message for us. You know what? Take care of the gut. You take care of the gut, you're going to have a good life, and you're not going to have chronic disease. So that's very, very important. Did I answer the question?
Yes, and we got one more.
Okay.
This is from Joseph 007, and he says he wants to know what's going on with the ozone. He says all the information that he looks up about ozone says that it's not healthy and that it's toxic. And he wants to know what the real issue is with ozone.
Well, again, thank you for that. And you're absolutely correct, because if you look at the FDA guidelines about ozone, according to the FDA, is a toxic gas that has no medical benefits whatsoever. Yet, if you do the research and you look at the literature, okay, we have thousands of doctors worldwide that have been using ozone for 60, no, actually more years, with great success. In the US, we have probably a few hundreds. I don't know the exact numbers. I've been using ozone, I would say probably 15 years now.
You know when it was first actually applied for medical use?
I'm sorry?
You know when it was first applied for medical use?
No, help me with that.
They actually had doctors, they were actually medics that were on the battlefield in the early World War II and World War I. They would actually use the gas form to disinfect their tools on the battlefield so that they could actually perform surgery and be sterile.
Well, thank you for that. I love history, don't you? Ozone kills every bacteria and virus known to man, okay? It detoxifies, it takes care of odors, okay? It used heavily in industry, okay? And it can be used just about in any part of the human body except the lungs. In other words, do not breathe ozone, because it irritates the lungs, okay? So you say, well, what kind of application ozone has? Well, as I mentioned before, it can be used into the joints, and what it does, it creates chaos, okay, that actually calls for repair and rejuvenation of the joint by the body's environment, by ability of the body to react to the chaos that ozone has created. And it's been used for decades and very, very successfully. Another way to use ozone is via ozonating the blood. Okay, and a couple of different ways. The ways that I usually use is to actually take a small amount of blood out of the patient, out of the vein, usually 60 cc's. We put it in a normal saline bag, IV, and then we take the ozone and put it into the bag. So the ozone ozonates the blood. Okay, and actually you can see the color. Usually it's going to be purple. As soon as you put the ozone in, what's going to be happening? It's going to be bright red, because the ozone, O3, actually part of it becomes O2, and blood that is rich in O2 becomes what? Bright red. And then what we do, we put it back into your system. So the ozonated blood actually activates the immune system. Okay. It's absolutely incredible with variety of diseases, especially chronic Lyme. And I've treated many patients with COVID, even though we can talk about that, but we should. Okay. It's also good for the autoimmune diseases. Okay. And it's not difficult to do. It doesn't take a long time. It takes about 40 minutes. And there's also pretty impressive. I also use ozone in case somebody has sinus issues, sinusitis. Okay. It's pretty amazing because you can introduce ozone into the sinus cavities, of course, without breathing it. And pretty amazingly, you get results almost on the spot. You can also use it in the ears. Okay. You can use it rectally. You can use it vaginally. The only thing you can't use it is what? As we said, breathe it. Also, we can use it on wounds, okay? Especially diabetic wounds, which are very hard to heal. And what we do is we use a bag, a plastic bag, and we put it in ozone, and you'll read it for me. I'm going to talk to this, and you're going to read it for me. So what we do, we put the ozone in the bag. So whatever wound we have is actually being exposed to the ozone. And that's also is very effective in treating that. So thanks for the question. It's really, antibiotics are being so overused. I can't even start to begin to tell you the consequences of overuses of antibiotics. Okay, it really ruins the gut flora, and that opens us to a variety of issues, including leaky gut. So, if anything is going on in your system that looks like inflammation or chronic autoimmune disease, etc., reach out to us, and we'll give you the right information so you can make a decision how to go about that. Okay, the next question.
Yep. This one is from Mindy T. She said, "What would someone do about small red bumps? They look like bug bites, but they may be scars from tick bites." She said, "Can tick heads stay in the skin long after they've been pulled out?"
Yes, they can. Okay, especially try to rip them off. Okay, so the best way to remove a tick bite is actually put Vaseline on it. Okay, and what happens is it cannot breathe, and then it disengages from the skin. So you have to be very careful if you use any kind of instrument to take it out. Okay, sometimes the head and the part that really penetrate the skin stays in there. Okay, but if it does, you should be able to see it, unless it's very very small tick. But the best way to do is actually to use Vaseline. Just put it on. In a few hours, it just falls off.
I didn't
Now,
know.
as far as now, the question was also scars of
Yes, she said that she's got some small red bumps. That she said they look like bug bites, but she's not sure if that could be one of the causes.
Well, again, this can be also a byproduct of inflammation. Okay, so in holistic medicine, anything that is related to skin is actually going back to where? Liver. Okay, and the liver goes back where? The gut. All right. So usually I need to see what it is. Okay. Again, if you're not in the vicinity of where I practice, which is down south in Bluffton, South Carolina, and Long Island, New York, you can always send us a picture, and I can make some decision on that. But yeah, we need to differentiate whether or not it's chronic bug bites, scars, or is it inflammation that can be treated very well with holistic approach. So we can resolve that.
Okay. The next one is from Whitney K. She says that she's had some problems with bile duct blockage. It's happened already 2 times.
What kind of blockage?
Bile duct.
Bile duct.
Bile
Okay.
duct blockage.
Okay.
This is post already after a year from removal of a gallbladder
Okay,
surgery.
okay.
So she's wondering, is there any good diet that she can get on, or anything that will help? Things are not well for her. I think she's experiencing some
Okay,
pain and
okay,
discomfort.
okay. All right, another great question, because unfortunately we have too many gallbladder surgeries. Okay, what do I mean by that? Uh, Usually when we develop any kind of gallstones or any kind of inflammation in the gallbladder, the first thing that conventional medicine suggests is take it out, take it out. The problem is they don't tell you side effects of taking it out, because what's the function of the gallbladder? The function of the gallbladder is really to contain the bile acids, the bile fluid that is a byproduct of liver metabolism that is absolutely essential for digestion. In what way? The bile emulsify the fat and gets it ready for what? For pancreatic enzymes to break down the fat into fatty acids so we can put it into the system and utilize it. All right. So once we get the gallbladder out, what happens now is as the bile gets produced, and it's 24/7, okay? But instead of going into the gallbladder, that then when we ate, or especially when we eat food, fatty foods, okay, which I recommend, then the gallbladder squeezes itself and gets the bile into the food, and now we're ready to continue with digestion, okay? So we have two issues. Number one, that bile goes into the gut when there's no food in there, which can create an irritation. So if that's the case, aloe product can help with that, okay? But more importantly, now that we don't have the good supply of bile when we eat, we need to take supplements, okay? So we have a supplement that contains what? Contains hydrochloric acid, digestive enzyme, and ox bile. And if you take that, then you could do the keto lifestyle, which is what? A lot of fat. The problem is if we don't take the supplements, you're not going to be able to handle the fats. And that's going to create what? It's going to get a problem. So what you're going to do is you're going to go what? You're going to go to carbs. Not a good idea. Okay. And I can tell you categorically that patients who come to me with history of gallbladder removal do extremely well on the light keto and on taking supplements that will help them not have a problem. Okay. So that's my best advice. And of course, don't forget the probiotics. It's absolutely essential.
All right. The next one is from Lisa B. And she says, "Hi, Dr. Dekel. I tried taking probiotics and found it made me very anxious after 3 days. What kind of probiotics would you recommend taking?"
That's a very interesting comment, that probiotics made you anxious. I'm trying to kind of figure in my mind why would it be connected? And right now, I cannot come up with an answer on that one. Okay, first of all, congratulations on starting probiotics. Okay, because that's one supplement you should not leave home without. Okay, so the right probiotics actually we use in our office actually have studies on them that show categorically that they help with uh, creating a flora that is supports good health, good gut. So again, there's so many different probiotics on the market that sometimes it's hard to decide which one is good, which one is bad. And I'm not saying the one we use in our office, the other one is good one. No, I'm not saying that at all. We have quite a few out there that will fit the bill. The question is, are they good for you? And if you are taking these probiotics and getting anxious, maybe you should take another brand and see if that happens. Now, anxiety usually is related to adrenal function. So I'm trying to kind of see if there's a connection of taking certain strain of probiotics and actually getting some adrenal surge, etc. I don't see that, okay, but I'm not arguing your point of connecting the dots of taking probiotics and now feeling anxious about it. So I think that the easiest part to do is, as the question asked, is there anything that I recommend? The question is very Very simple. Yes, we do. And what we do is we're going to put on the site how to connect with us and how we can recommend whatever products
Absolutely. I'll send it.
that you may need to help you with not getting anxious. And if this continues, by the way, just reach out to us and find out what else is going on, if there's going on. Okay?
All right. So that's it for today. We're all out of questions.
That's it for the day.
That's it right now. We
All right. Okay. Well, I hope we answered the questions in a sensible way that you can actually convert to good decisions. If you feel that information is not enough for you to make good decisions, just let us know, and we'll always respond to make sure that you got the information so you can make a decision. So would like to thank you. Thanks, my crew. Thank you very much.
Thank you.
And
episode 1 down.
down. And we're going to reconvene in 2 weeks on Sunday at 6 p.m. Again, I encourage you to spread the news. This is a free consultation. It is, all right? It gives you real good answers, down-to-earth answers of what you can do with what bothers you, all right? So don't be shy about it. Spread the good news. Connect with us in any way you can. Make comments, okay?
Yeah, don't forget to subscribe and like and share, because it really does help us be able to spread the message of healing. And like he said in the beginning, it's a lack of information. The more that we can spread the information around, the more people are going to be helped by that information. And we can't do it without your help. So thank you for your support. Love to all. Stay well. Be well. Take care.
Be good. Have a good one, guys. Take care. Bye-bye.